Do you believe in demonic possessions? What made you a believer? I'm a psychiatric nurse in a state-run mental health facility in rural Pennsylvania, working the night shift for the past 12 years. I've seen a lot, patients with schizophrenia, bipolar disorder, severe PTSD, you name it. Most of what we deal with is explainable: brain chemistry, trauma, or stress manifesting as delusions or erratic behavior. But there's one case from 3 years ago that still makes me question whether something else, like demonic possession, could be real. A patient, a 19-year-old girl we'll call Jane, came in with no history of mental illness, admitted after her family said she was taken over. She spoke in a guttural voice that didn't sound like her, knew things about staff she couldn't have, personal stuff, like my coworker's childhood nickname, and trashed her room without touching anything, like books flying off shelves. Doctors diagnosed acute psychosis, but meds didn't touch her symptoms. Jane's episodes were unlike anything I've seen. During one, she stared right through me, reciting details about a patient who died in the ward years before I started, stuff not in any chart. Restraints didn't hold. She'd slipped them without effort. Her family, devout Catholics, brought in a priest for a blessing, and Jane screamed in a language none of us recognized. Later, the priest said it was Latin, though Jane had never studied it. After a week, she suddenly snapped out, like a switch flipped, and had no memory of it. She's fine now, last I heard, but I can't shake it. Psychiatry often explains possession-like symptoms as dissociation or schizophrenia, and I get that. Textbooks say extreme stress can mimic these behaviors. But I've seen psychosis before, and this felt different, heavier, like something was in the room with us. I'm not religious, but I'm open to things science hasn't fully explained. Most of my colleagues roll their eyes at possession talk, sticking to DSM-5 diagnoses, but a few older nurses have stories too, patients who defied logic, like a guy who predicted a staff member's car accident hours before it happened. I keep it to myself. You don't want to sound unhinged in this job. How do you stay grounded when the line between mental illness and something else gets blurry? I'm still wrestling with what I saw.